Hey everybody, it's Allison from Thriving Well Disabled. Just wanted to say hi and check in with you all. How you guys doing? It's COVID-19 and it's stressful. Please share with me how things are going for you, okay? I'd love to hear what's going on in your neck of the woods. I'm in central New Jersey, and so we're getting hit pretty hard. And I know people who've tested positive. I know people who are waiting for tests. I know people who are, just very realistically afraid. What I want to talk about, though, today is mental health. Protecting your mental health is really important, and it's a very stressful time for everybody right now. And for those of us with disabilities, it can be very scary. A lot of us have compromised or somewhat compromised immune systems, which increases our risk. There's also a lot of people in our community who specifically have pulmonary or lung and breathing issues, and those people are at even higher risk. And so, yeah, it is a scary time, period. Some fear is absolutely an appropriate response. The problem is when you reach a certain point of fear, your ability to reason gets damaged and the fear stops being helpful. It makes a lot of sense right now to stay home. It makes a lot of sense right now to quarantine or at least social distance and minimize your contact. That kind of response makes a lot of sense right now. Makes a lot of sense right now to be prepared, to have cold treatments available at your house, to be in contact with your physician if you have symptoms. Things like that make absolutely perfect sense and are appropriate. However, panic and just straight up fear are going to hurt you and not help you right now. Fear and anxiety can actually weaken our immune system because our bodies don't differentiate between different types of stress. So the more stressed we feel, the harder it is for us to do what we need to do every day to get by, and the harder it is on our bodies and our immune systems. So what can we do? Well, one thing is distract ourselves, find other things to look at, to think about, and do what we have to do to be prepared, and then not think about it for a while. I'm very serious. If you're sitting at home, you don't need to be worried all the time. If you're sitting at home, you're in a safe space, hopefully, and you can take care of yourself during this time. And you don't need to be thinking about it all the time. You don't need to be checking the statistics all the time. You don't need to be looking at all of that. It's not helpful for you. I have a bit of a hard time following that myself, but what I do is my partner and I limit ourselves, and we check the news once or twice a day, and the rest of the time we don't look, we don't think about it, we focus on other things. What else can you do? Exercise. Right now I know a lot of gyms are closed to help with social distancing, but that doesn't mean you can't exercise. It means you have to be more creative about it. What I did before and I'm still doing is walking on this nature trail right by my house. And this gets me out in nature, gets me surrounded by plants and trees and creeks, and those tend to be very relaxing. They help your body kind of recuperate. So think about if there are any parks in your area or walking trails near you that you could go to. Yes, you might run into other people there, but as long as you're cautious, you're okay. It lingers in the air, but that's contained spaces. Open spaces, you're safer. You do want to maintain social distancing as much as you can, but walking by somebody on the trail for a minute isn't that big a risk. It's if you stand there and talk to them, that's when your risk's going to increase. So that's one big thing. If you can, go for a walk in nature in whatever way you can. That might be walking around your backyard. That might be going to a nearby park. That might be a nature trail nearby. If you live in a rural area, just, go outside for a bit. If you live in an urban area, if there's a deck or a space where you can just enjoy fresh air, do it. For exercising, if you don't normally have equipment, that's okay. You can try yoga, you can try Tai Chi. There's lots of things online that have free or inexpensive exercise routines or topics for you to do. And take a look, find something that feels like it's a fit for you, and do it. This could actually be the way to start a new, healthier habit for yourself. But you definitely want to try to get some exercise. If you've got a condition that generally keeps you from exercising, think about what's exercise for you. That might be, taking a shower that day. It might be, doing some cleaning. And it might be, just going out onto that porch or going over to the window. Whatever it is, get yourself moving a bit more than you usually do. If you need to, play some music and just groove to it. But try to get some form of exercise in there. It'll help release some endorphins, which can help you feel better. And it gives your body the extra juices it needs to keep going. Juices is a bad word, but you know what I mean. Exercising is especially important right now. What else can you do? Well, you can still try to eat healthy. Whatever that is for you, depending on your diet, things like that. Maybe you get some extra exercise by cooking things instead of heating them up. Maybe you just, are more cautious about what you order or more thoughtful about what you put in. Don't add the extra salt or, try that other, when you go to if you are going to the grocery store, try something that you don't usually try that's a little healthier maybe. Things like that. Just try to get a bit of healthier food into you. And when I say healthier, I mean fruits and vegetables, things without much added sugar. And again, it's going to depend on what your dietary needs are. But just try to have that little bit more in there. And again, I'm not saying full dietary change because that's going to be just stressful. But just take a couple of extra minutes to think about what can you do to make sure that you and your family are eating a little bit better. Because healthier eating is going to help you. What else? Exercise, healthy eating. The other big thing right now is we've got a lot of anxiety in the air. I know my symptoms have been a lot higher the last couple of weeks. Doing good. I've been a lot higher the last couple of weeks because of all of the stresses. So what do? I make sure I'm doing my walks every day. I spend time meditating. I have a gratitude list, a gratitude journal that I keep. I just do what I can to find those positives and hopeful things. If you aren't familiar with these concepts, I've got little talks like this that I've done about most of these over the past couple of weeks. Because I do think that right now, there's been some work on talking about our physical needs and social distancing and things like that. It's harder to talk about your mental and emotional needs. Humans are social creatures. We're used to that connection. We're used to seeing each other face to face. We're used to that conversation. And right now, it's not safe. And so we have to adjust to manage that. How do we do that? Well, one thing is use any kind of video communication that you can. I'm talking a lot with a friend of mine who lives in Denmark, and she and I are catching up because right now it doesn't matter that I'm, almost a third away around the world from her. What matters is we can both get online and chat, and we're both stuck at home. So we compare stories about how things are going, and we talk about our lives and things like that. It's healthy, it's distracting. See if there's folks, even if you don't have a lot of friends you could talk to, get onto Facebook groups and other spaces and just, set up some conversation time or co-working time or whatever it is you need so that you can connect to other living, breathing human beings and get at least some of that. We're also very touch-starved right now in many cases. And so think about things that you can do to help yourself feel better. Wear that extra comfy outfit, or use a weighted blanket, or cuddle with a pillow or a pet. Whatever you can to get some of that touch sensation that we need as a species. But right now we can't get it in a lot of the usual ways. I just want to make sure that you guys are aware that it is very important that we follow the social distancing and take care of ourselves in those very physical ways. But that leaves us vulnerable to other needs. And what we can do in managing that, what we can do to manage that is important. And what we can do to keep ourselves in a relatively good state of mind and to keep ourselves safe mentally, physically, and emotionally is very important. All right, guys, stay safe, stay connected. I'm thinking about you, and above all, keep thriving.